Have you ever walked into a room and suddenly forgotten why you came in? Or spent 10 minutes searching for your keys, only to find them already in your bag? These little slips of memory can feel frustrating, even a little scary. But take a breath. You're not alone. What you're experiencing may be what's called transient global amnesia, a brief, harmless lapse that doesn't mean something is deeply wrong. It happens to many of us as we age, and it's more common than you think. So what exactly is it? Transient global amnesia is a transient memory disorder that primarily affects the hippocampus, an area of the brain that plays a key role in forming and storing memories. It is a sudden phenomenon in which the patient loses the ability to form new memories, anterograde amnesia, and cannot recall recent events, retrograde amnesia. However, this condition usually lasts only a short time, usually less than 24 hours, and in most cases does not have long-term consequences. Transient global amnesia is considered an independent condition, not directly related to serious medical conditions such as stroke, traumatic brain injury, or epilepsy, although its symptoms may be similar to some other conditions. People with transient global amnesia remain alert and aware of themselves and their surroundings, but may exhibit confusion or repetitive questioning due to an inability to remember new information. Symptoms usually resolve within a few hours to a maximum of 24 hours. People remain alert, aware of their identity, and able to perform familiar activities. There are no signs of physical damage to the brain, such as paralysis of limbs, speech disorders, or loss of motor control. After a transient global amnesia, people usually regain their memories without any lasting effects. Transient global amnesia is a rare phenomenon, with an estimated incidence of 3 to 10 cases per 100,000 people per year. It usually occurs in older people, especially those between the ages of 50 and 80, and is rare in people under the age of 40. The most characteristic symptom of transient global amnesia is the inability to form new memories and recall recent events. Some specific signs include sudden confusion. The person may feel confused and not understand why they are in a certain place or what they are doing. For example, they may repeatedly ask, "What am I doing here?" or "How did we get here?" Repetitive questioning. Because they are unable to retain new information, the person may ask the same question over and over again, even after it has been answered. Retained awareness and self-awareness. Despite memory loss, the person still knows who they are, recognizes loved ones, and can perform familiar activities such as driving or using everyday objects. No obvious signs of nerve damage. There are no symptoms such as muscle weakness, paralysis, or difficulty speaking, which help distinguish transient global amnesia from a stroke or seizure. In addition to the main symptoms, some other signs may appear. Anxiety or confusion. The person may feel anxious because they do not understand what is happening. Difficulty focusing on current events. Although they are still conscious, they may have difficulty following conversations or events that are happening. Gradual recovery. After a few hours, the person's memory usually returns to normal, but they cannot remember what happened during the time of the temporary amnesia. Transient amnesia has a number of symptoms. To make an accurate diagnosis, the doctor needs to rule out other causes such as mini stroke, TIA. Causes similar symptoms but is often accompanied by neurological signs such as weakness in the limbs or difficulty speaking. Seizure. Can cause confusion, but is often accompanied by seizures or loss of consciousness. Head injury. Can lead to amnesia, but there is usually a clear history of trauma. Other brain conditions, such as brain tumors or Alzheimer's disease, can cause more lasting memory loss. Diagnosing transient global amnesia is often based on clinical symptoms and ruling out more serious causes through a physical exam and laboratory tests. The exact cause of transient global amnesia is not fully understood, but researchers have identified several factors that may contribute to or trigger the condition, such as sudden immersion in cold or hot water. Sudden changes in temperature can stress the body, affecting blood flow to the brain. Strenuous physical activity. Activities such as high-intensity running, heavy weightlifting, or strenuous exercise can cause transient memory loss. Sexual intercourse. The intense intensity of sexual activity can trigger a transient memory loss. Medical procedures. Procedures such as angiography or endoscopy can stress the body, leading to temporary memory loss. Minor head injury. Although temporary memory loss is not directly related to a serious head injury, a minor injury can be a trigger. Emotional stress. Bad news, conflict, or overwork can cause psychological stress, increasing the risk of temporary memory loss. In addition to triggers, certain conditions or lifestyle habits can increase the risk of temporary memory loss. Medications. Certain medications such as sleeping pills, benzodiazepines, cholesterol-lowering drugs, statins, beta blockers, or anti-anxiety medications can cause or worsen temporary memory loss. Malnutrition. Deficiencies in essential nutrients, especially vitamin B12, can affect brain function, leading to temporary memory loss. Drinking and smoking. Alcohol reduces blood flow to the brain, while smoking damages blood vessels and reduces oxygen supply to the brain. Lack of sleep. Not getting enough sleep or poor quality sleep can cause fatigue, affecting memory. Depression. Depression can impair cognitive function and contribute to temporary memory loss. Cortisol hormone. High cortisol levels due to prolonged stress can affect the hippocampus, causing temporary memory loss. Underactive thyroid. Hypothyroidism can reduce energy and affect memory. Mini-stroke, TIA. Although rare, some temporary memory loss can be associated with transient ischemic attack. Although the exact cause is unknown, some theories suggest that transient global amnesia may be related to a temporary interruption of blood flow to the hippocampus, or memory-related areas of the brain. This may occur due to venous obstruction. Interruption of blood flow in the veins can reduce oxygen supply to the brain. Neural dysfunction. Certain temporary disturbances in the activity of nerve cells in the hippocampus may cause transient amnesia. History of migraines. People with a history of migraines are at higher risk, although the link is not clearly established. Transient global amnesia primarily affects people between the ages of 50 and 80, accounting for about 75% of cases. Factors that increase the risk include history of cardiovascular disease, heart disease, high blood pressure, or hyperlipidemia, high cholesterol, increase the risk of impaired blood flow to the brain. Migraine. People with a history of migraines are at higher risk. Age. Blackouts are rare in people under 40, but the risk increases as they get older. Gender. Some studies have shown that men are slightly more likely to develop blackouts than women. Blackouts are generally not considered a serious condition if they occur only once and do not recur. Symptoms usually resolve within 24 hours, and people usually recover completely without long-term effects. However, because blackouts can mimic more serious conditions such as stroke, seizures, or brain tumors, a doctor's visit is necessary to rule out serious causes. If blackouts recur repeatedly or are accompanied by other symptoms such as difficulty speaking, weakness in a limb, or loss of consciousness, the person should be thoroughly evaluated to determine the underlying cause. Some cases of transient global amnesia can be an early sign of more serious health problems, such as cerebrovascular disease or neurological disorders. To diagnose transient global amnesia, your doctor will rely on your medical history, clinical symptoms, and laboratory tests to rule out other causes. Diagnostic methods include neurological examination. Your doctor will check your reflexes, sensation, muscle strength, posture, gait, and coordination. Cognitive assessment. Ask questions to test your thinking, judgment, and memory. CT scan. Shows cross-sectional images of the brain to detect abnormalities such as broken blood vessels, narrowing, or past strokes. MRI scan. Provides more detailed images of the brain, helping to evaluate structural or functional abnormalities. Electroencephalography, EEG, records the electrical activity of the brain to rule out epilepsy or other neurological disorders. Blood tests may be done to check for factors such as vitamin B12 deficiency, thyroid disorders, or signs of inflammation. In most cases, transient global amnesia does not require specific treatment, as the symptoms will go away on their own. However, treating the underlying causes or triggers can help prevent recurrence. What if I told you the best brain medicine doesn't come in a bottle, but in your legs? That's right. Movement is one of the most powerful tools. You have to keep your brain sharp. Just a 30-minute walk each day, around the neighborhood, through the park, even inside the house, can increase blood flow to your brain, boost oxygen, and improve memory. Studies show that regular physical activity helps grow the hippocampus, the part of the brain that handles memory and learning. And it doesn't have to be hard. Dancing to your favorite oldies, stretching in the morning sun, taking the stairs instead of the elevator. All of it counts. Physical movement isn't just for the body. It wakes up the mind. It lifts your mood. It helps you sleep better. So next time you feel foggy or down, get moving. Your brain will thank you. Coming up next, we'll talk about a second kind of movement, mental movement, and how learning something new keeps your brain growing strong. Just like your body needs movement, your mind needs challenge. And no, we're not talking about college exams or complicated math. We're talking about simple mental stretches, things that keep your brain curious and growing. Reading a book, pet care, learning to play a new song on the piano, rehearse a play or play with a group of friends, trying out a recipe you've never made before. Even something as simple as doing a puzzle, playing a card game, or learning a few words in a new language. Each time you learn something new, your brain forms new connections. It's like watering a garden. And it's never too late. In fact, older adults who keep learning often perform better on memory tests than younger people who stop challenging themselves. The goal isn't to be perfect. It's to stay curious. Curiosity is fuel for a long, healthy mind. So ask questions. Explore new things. And let your brain dance a little. Entertainment can help the elderly practice and improve their memory significantly. The elderly often have psychological anxiety and fear of many things, causing stress and possibly leading to depression. Therefore, entertainment is an effective therapy to help relax the spirit in the elderly. Different forms of entertainment will help distract psychological worries, create excitement and joy in life. One of the effective benefits that entertainment brings to the elderly is to increase concentration. Many elderly people often tend to be distracted and lose attention, so entertainment will help players focus their thoughts, find solutions to win the game, contributing to improving the concentration of the elderly. Next, let's talk about something just as powerful, but often forgotten: connection with others. We were never meant to do life alone. As we age, it's easy to feel isolated. Children move away, friends pass on, daily routines grow quieter. But loneliness isn't just sad, it can actually harm your brain. Research shows that prolonged isolation is linked to memory loss and faster cognitive decline. The brain is a social organ. It needs conversation, laughter, shared stories, even quiet companionship. A simple phone call, coffee with a neighbor, joining a local walking group, volunteering, or even playing cards once a week. These moments of connection, they stimulate your brain, lift your mood, and protect your memory. So if you've been feeling a little alone lately, reach out. Even a small hello can open a door. Up next, we'll look at something deeply personal: how your emotions affect your mind more than you might think. Your emotions are powerful. They don't just affect your mood. They shape your brain, chronic stress, anxiety, or sadness can shrink parts of the brain involved in memory. But the opposite is also true. Positive emotions help your brain grow. Practicing gratitude, spending time in nature, writing in a journal, even just pausing to breathe. These simple acts calm your nervous system and protect your mental clarity. You don't need to feel happy all the time. But creating space for peace, joy, and reflection is like watering the roots of your mind. So next time life feels heavy, pause. Breathe. And know your mind is listening. A good night's sleep isn't a luxury. It's a necessity, especially for your brain. While you sleep, your brain doesn't rest. It cleans itself. It processes memories. It strengthens what you learned that day. That's why lack of sleep can make you forgetful, foggy, or even moody. Older adults often struggle with sleep, waking up often, sleeping lightly. But small changes help. A consistent bedtime, less caffeine, no screens before bed, and a calming evening routine. Sleep is when your brain files memories into long-term storage. So give it the rest it deserves. What you eat feeds your brain. A diet rich in colorful vegetables, leafy greens, berries, whole grains, fish, and healthy fats has been shown to support memory and slow mental decline. This is called the Mind Diet, a blend of Mediterranean and DASH diets. Simple, delicious, and brain-friendly. Hydration matters too. Even slight dehydration can affect concentration and alertness. And remember, it's not about perfection. It's about small choices. A salad here, a handful of nuts there, a little less sugar, a little more color on your plate. Every bite you take can be a step toward a sharper mind. Sometimes, memory problems aren't about age. They're about health. Conditions like diabetes, high blood pressure, thyroid issues, vitamin deficiencies, or even certain medications can affect how your brain works. That's why regular checkups matter. They catch small problems before they grow bigger. Don't hesitate to talk to your doctor if something feels off. It's not weakness, it's wisdom. Caring for your body is caring for your brain. Taking care of your brain is not just about preventing transient global amnesia, but also a strategy for maintaining your quality of life, especially as you age. A healthy brain improves your ability to think, remember, and enjoy everyday life. By combining measures such as exercise, healthy eating, stress management, adequate sleep, and managing underlying medical conditions, you can build a strong foundation to protect your cognitive function and reduce your risk of neurological disorders. It is important to raise awareness about transient global amnesia and related problems. Patients and their families need to be educated about the signs, treatments, and prevention measures so that they do not feel overwhelmed by the condition. If you or a loved one experiences any signs of transient global amnesia, seek medical help immediately. A healthy lifestyle, combined with timely medical care, will be the key to protecting brain health and enjoying a full life. Growing older isn't about fading. It's about becoming more. You are not the same person you were at 30, and that's a good thing. You're wiser, deeper, and still growing. Every walk you take, every book you read, every laugh you share, it all adds up. Staying mentally sharp isn't about chasing youth. It's about honoring who you are today and giving your brain the life it deserves. So keep learning. Keep moving. Keep connecting. And never stop being curious. Because at any age, your mind is a beautiful place.